Andre.
I'm Frank.
And together we're HelpWear.
Healthcare everywhere. So we all started this because of an issue that started with me. My mother has many medical conditions, hard of hearing, sight, and heart condition. So one day when I came home from school, I found that my mom fell down the stairs and broke her leg. We went to the hospital and the doctor said she actually fell because of a cardiac event. But the doctor couldn't say what happened because there was no data about the issue.
Now, Frank and I very quickly learned that this wasn't just an issue that Frank faced. Heart-related illness is a major issue not only in Canada but all around the world. We see each year over the past decade the number of Canadian patients affected by heart-related illness has increased by 7.8% or more each year every year. So we're now at a point where another Canadian dies once every 7 minutes, so roughly 4 during the length of this presentation. And this isn't just a social issue either. Last year alone, the cost due to late response to heart-related illness to the Canadian healthcare system was $22.2 billion. This is because when a patient has a minor heart condition, like an arrhythmia that goes untreated, it results in costly operating room time, different treatment plans, and recovery time.
To solve this problem, there needs to be a solution that provides around-the-clock, non-invasive heart monitoring. This increases the likelihood of EMS response and provides an innovative way to have healthcare monitoring at home.
The solution is HeartWatch. HeartWatch is a 24/7 heart monitoring system that has automated emergency response, and it's all affordable and accessible for patients all around the world. So now we're going to be doing a demonstration of HeartWatch.
So this is our current phase prototype. Simply, I can just go into the app, it tells me my biometrics, and right now I don't have a cardiac situation, so it won't trigger, but if a patient needs to contact help, they can easily contact help anytime by simply doing 2 clicks, and it'll send a message to Andre's phone.
So it just said HeartWatch system, and then it said that this is an automated message from HeartWatch. The patient, Frank Nguyen, needs medical assistance. So on the final iteration of this product, what will end up happening is this distress message, which goes over SIM card just like the way your mobile phone works. This message will contain all the user's prior medical data, as well as what medications are currently on. So by the time ER actually engages with the patient, they already have all of that information without needing to communicate.
You can pass it around to look at this.
So this is actually our first prototype. We'll explain that we're a long way from there very soon.
The main user of HeartWatch would be baby boomers who are at risk of heart disease. This accounts for 5.6 million people in Canada alone, but that's not if they're part of the 69,000 Canadians who die annually due to heart attacks. The reason we're starting this now, for the past 5 years, the amount of heart-related patients have increased by 20%. And the baby boomer industry takes up $150 billion of the Canadian healthcare budget, and there currently is no 24/7 automated system that can contact help for you on the market.
So when we talk about our competition, there's kind of 2 major competitors that people discuss. So the first one is people like to compare us to consumer-grade heart analysis devices. So this is your Apple Watch and your Fitbit, right? And then our other main competition is Philips Lifeline. So Philips Lifeline markets a button that's either worn around the patient's neck or around the patient's wrist. And they can press a button between 1 and 5 times to call pre-programmed cell phones, right? And then the last thing is a Holter monitor. So a Holter monitor is if anybody who's ever had a heart condition, the doctor sends you home with a 12-lead Holter monitor. You wear it for 24 hours. You can't wear it in the shower. It's a very uncomfortable 24 hours, but it gives the doctors all the data that they need. So really when you look at our system, we have not only the pulse oximetry, so that green light that you get off of Apple Watch or Fitbit that gives you very surface level analysis, so not enough for a cardiologist, but we also give you a miniaturized real-time electrocardiograph, which is seen only in the Holter monitor, right? The other thing is we're extremely low cost. Right now it costs us less than $200 to manufacture all the components that are on the system. And the last thing is the fact that we have this automated emergency response. So one of the limitations of Lifeline is the fact that it isn't automated. It relies far too heavily on the user's medical knowledge. They have to say, okay, I'm having a heart attack, and then press the button. Where we see that 72% of minor heart attacks, so not the ones where people collapse, but minor arrhythmias go undetected. Now the last thing is the fact that Philips Lifeline relies on an existing telecommunication line, meaning if you leave your house and you have the system, it is no longer effective. But since we operate off of a SIM system, it can send that message anywhere. So channels of revenue. So right now we have 3 major channels. So the first thing is doctor referrals. So that's where we have doctors who refer patients who are at immediate risk of heart failure. The second thing is our websites and advertisements, which is really our website sales. And then the last thing is insurance companies. So doctor referrals is when you have a cardiologist and they say, okay, these patients are at immediate risk. So we work with Dr. Paul DeLorean, who's the head of cardiology at St. Michael's Hospital, and he says that 12% of his patients are at immediate risk and he would put them onto this device. So what that means is that 670,000 patients in Canada are rated right. And then websites and advertisements is more for a concerned family member or somebody who wants to purchase the product. And then lastly, insurance companies. It's kind of an odd angle, but when you talk to the American market specifically, you have these health insurance companies, and they get to alleviate their risk by putting their user on the system. So it kind of works as a bursary program where they would give it to the patient at a reduced cost, and it also helps reduce their risk as well and increase their profit margins.
So over the span of 8 months, we brought our product down from this yellow box to our current system, which is a one-band strap.
So one of the things that you'll notice is you guys both have both of the systems in your hands. So that first system there, it was 3D printed, it had a lot of off-the-shelf components, which caused far too much noise. So when we started working with cardiology, it just didn't give us the data that we were able to use to do emergency detection. So we started building a smart strap for the Pebble Watch, so that's where we actually had the electrocardiograph on board, so a 24/7 Holter monitor. And then lastly, now that we've done printed circuit board designs, we've miniaturized the system into a low noise printed circuit board, we've been able to integrate it all into one seamless strap. So that's how you've kind of seen the development from what we call the soapbox model, that big yellow box you held, to this device.
So HelpWear is actually very environmentally friendly. Because we're not trying to make a disposable product, we're trying to make a product that lives for a long time, that can stay with the user for a very long time. Next is that we're ROHS compliant, meaning that we are a lead-free product. It can be thrown away if the user decides to, and it won't affect the environment. It can be recycled easily. And thirdly, we're actually being made in Canada, designed by Canadians, produced by Canadians, so everything is done to standards of what we would call ethical.
So HelpWear in the media. So Frank and I have had the privilege of having a large variety of media attention. We've been seen on CBC, Global News, CTV, we've even met the Prince of England. And if you actually go through all of our different media outlets and you see how many video views we've had, they now surpass 56 million people. So we also have our Facebook account, which has about 315 likes, and we get over 15,000 views on every one of our posts. And then we also have our website, which is kind of where we get the most contact with our direct people who are going to be our consumers. So kind of these different media outlets have not only been able to make connections with like the clinical environment, but also with people in the business world. But actually the most interesting thing is this is where we get the most engagement with our future customers. Right? This is where we have the people who contact us and say, you know what, this affects my mother, this affects my son. And this is really what's kind of tailored our development the most, because it's with those personal stories that we've been able to drive development. To really fit not only what the user would need, but then we also now have a partnership with the biomedical zone. So the biomedical zone is an incubator, and it's in collaboration with St. Michael's Hospital and Ryerson University. So we actually do all of our clinical research out of St. Michael's Hospital. So what that means is we have the full support of both the faculties of cardiology and emergency medicine. So this has really given us unprecedented access to the physicians, and we've been able to tailor the product not only to what our consumers need, but also from a clinical perspective to what the doctors require as well. This is things as simple as when you're building an emergency response system like this, you would think that maybe when you come into the ER, the doctor would be able to immediately get the data. Well, the technical systems just aren't there yet. So we've made it so that when the user walks into the hospital, we print off a summary that resembles a Holter monitor summary. So the doctor already knows how to read our system's data. So there's no training involved. And these are things that we've only been able to do with our partnership with St. Mike's. And Frank and I are also going off to university next year, both into engineering. I'm between U of T and Waterloo, and Frank's for sure going to Waterloo. So we're in talks with Velocity, which is the incubator there.
This is our team. That's CEO Andre Berger. He's also been the leader in the Resilience Anti-Homeless Campaign of Toronto.
And this is Frank, and Frank has won a gold medal at the University of Toronto Science Fair. And Frank and I actually met at MATS, which is the Math and Science Technology program. It's the Enriched Math and Science program in our high school, where they give us technical skills very early on, and they focus on finding technical solutions to real-world problems, which is really what we've been trying to do now.
The development of HeartWatch means that my mother, whenever she needs help, she can get it immediately. It means that whenever she has a cardiac event, there's data for her to get better treatment for my mother, or for my doctor, maybe. And it just means that I feel safe at school, knowing that my mom will get help whenever she needs it. Producing HeartWatch means that not only does it help people get through heart illness easier, but also means prolonging life to actually build a better community.
So if you need to contact us, you all have our business cards, and also you can contact us through our website, email info@HelpWear, or contact us through Facebook or Twitter. Thank you.